Welcome to the Retirement Roadmap by SHP Financial, a podcast empowering today's retirees and pre-retirees to make well-informed financial decisions that will help you spend more time living and dreaming than worrying and wondering. Are you ready to get started? Let's go.
Welcome, everyone, to another edition of the SHP Retirement Roadmap podcast. And we are back. We have a repeat guest on today. We're super excited. We have Scott Hokanson, owner of Brabo Benefits. So first off, welcome back to the
Thanks
show.
a lot. Appreciate you guys having me back on.
Yeah, for those of you who don't know, we look at the 5 areas of SHP Financial of income planning, investments, taxes, healthcare, and then legacy planning. Well, inside the healthcare world is all about like health insurance, Medicare, long-term care. And it works with the tax code as well, because the more you make, the more Medicare Part B premiums go up. So it's all intertwined. But Scott plays a huge role on our team. Helped so many of you listening right now, and so many of you that are going to join us in the future. He's going to be your go-to. So Scott, we also have, I know I probably shared this in the last one, but I can't not share it. When we started, so SHP started in 2003. And we
in an attic of Hokanson.
I was your first landlord.
It actually, it worked out great because we didn't have a clue and we didn't have any money to start. So Scott was our seed funding. He had an empty attic.
Yeah, we had an attic. Yeah.
No, it was an attic. It was the second floor.
Storage facility with all our filing cabinets.
Yes.
You might have had to go through a few boxes to find us. But that's where SHP started, was in their building in Pembroke on Scoosett Street. And we were there for the 2003 to 05, I think. And then we kind of came down to Plymouth, and then that's where it all started. So thank you again.
Listen, it's amazing seeing what you guys, I was just talking to Michelle, and you guys are creeping up on, you've got 3 locations, almost 50 team members here.
Yeah.
It's unbelievable.
It's been a fun
Congratulations.
time. And even our team members here, I always tell our clients, like, when we sit across from them, they're like, oh, thanks, Derek, this is a lot of work. They don't realize, I tell them, like, there's so many people behind the scenes. Yeah. Like, your team's helping on the healthcare side. We have our planning team helping on the just financial planning and tax planning. We have our portfolio team. So there's so much going on behind the scenes where the client just sees an advisor in front of them handing them the end product and so forth. But yeah, so go ahead.
No, right. I've loved being a part of it, and I'm proud to be able to help you guys on something that is so personal, so intimate, and so important. It is everybody's them and oftentimes their spouse's health care. And health insurance is what I sell. That's how I get paid.
Yep.
But it's the health care that we have to be concerned about, and helping people make sure they have access, which is an incredible problem right now. Yep. Doctors not taking new patients, and I'm sure a lot of your customers have decided to change. They raised their family in one area. Now they're moving, to wherever they're moving to, and signing up with doctors and having access is one of our biggest challenges, which is why, I think you send your clients to me and our team, because we make sure, first off, they have access to the care they need. Yep. And then we work on the pricing after that.
Well, that's a huge thing. If we think about, like, when that's the white glove service we provide to our clients, it's so easy when we refer them to Scott and his team at Brabo, because we know they're going to get taken care of just the same. And I always say, listen, this isn't like a sales thing where they're going to try to sell you some health insurance. They're going to look at your situation and advise what's best. It's not, they've been doing it for a long time. They don't need every single penny. They're not trying to get every last dollar. It's just trying to help you navigate.
Put you in the right direction.
It's complicated. So
it is. Let's just talk about that. I mean, there's really 2 different stages. Yeah. You can get health insurance on your own if you're under age 65.
Yep.
Lots of times people look at, okay, I can't retire until I'm 65. I know I get Medicare at 65. Medicare at 65 is such a positive because you've been paying for Part A your whole life. Part A is worth about $500 a month. Yeah. So you've been paying for it. Your employer's been paying for it. So the reason why Medicare is cheaper and better and all that type of stuff is because you're starting on third base. Yeah, you're starting, if you want to get to home base, you're starting on second or third base. So Part A of Medicare is why Medicare makes it all much more affordable. But if you're able to and you want to retire at 60, we can also help you there too. Yep. It's not going to be your favorite meeting. It's expensive. Do you know what I mean? And what I've found too is people that have that ability, people that have the ability to retire early like that, usually are coming from successful environments. Yeah. And those successful environments usually have really good employee benefits. And the private market, you're going to have a bit of an adjustment. There's no longer going to be a no deductible plan and whatever else. That's right. So I'll still make sure they can see who they want. But on average, 60-year-old in Massachusetts, you're going to be paying about $1,000 a month in fixed expenses. But you can be exposed to $5,000 to $10,000 of variable expenses per person.
Deductibles and all that.
Yeah, deductibles and all that kind of stuff.
Keith, we were talking about FAIR. How many clients have we sat down with that have plenty of money to retire, but they're like, I just don't know if the healthcare situation really has me bothered?
Yeah, they're extremely hesitant. Probably because a lot of it's like an unknown, like Scott was just saying, hey, look, I have this great coverage right now. Now I'm going to let that coverage go, retire, right? And step out into a different environment where the coverage, like you said, paying a little bit more than I probably did when I was working, or a lot more. And when I go see the doctor, I still have to come out of pocket with a lot of things. All that being said, I always tell people, look, there's two things you're never going to get back: health and time.
Yeah.
You know what I mean? If you can retire early and your plan fits it and you feel comfortable doing it, it's something you should definitely explore, and health insurance shouldn't be the barrier to having to make that decision.
It's a budget item. And for those of you that are a long way away from retiring and your employer's office, a health savings account can actually help you. And where I've found health savings accounts help as well is mentally people have chosen that money to go towards their health insurance.
Sure.
Just, you know what I mean? Like, it's in a different bucket. And I think how you guys, I'm not the financial advisor here, but what you guys feel about health savings accounts, but it's just another way to help pay for your health insurance. And when you're retiring, you've got a little bucket there that is part of your plan that in your mind and your spouse's mind has been dedicated to this. It kind of makes the decision a little easier.
Oh, yeah.
You know what I mean? So
there's two things on that. One, for so many clients now, I say, listen, because I think clients, the thing when they don't have a financial plan, like, it's one thing to have a portfolio, but to have a plan where you can see things playing out over time. I always say, do you want to just get by and retire, or do you want to know what's possible? Because what's possible is we just build an extra budget for $25,000, $30,000 a year from 60 to 65, or whatever it is.
Right.
And a lot of times their plan holds it just fine. So it's like, if every day you go to work, you're just doing that to pass on assets to the next generation. Now, maybe that's maybe that they want to, or maybe they'd be bored to retire. But that's the first thing: is make sure if you're not retiring because of healthcare, there could be it could be a logical reason to not retire for some of you. But some of you might have saved enough where you have plenty, where you just build it into your budget and you're fine. Secondly, HSAs are amazing. I
was hoping you could unpack a little bit, because we've talked a lot about HSAs.
I'm going to ask Kevin while we're going. Maybe you can give us during the show the episode, because we had one of our clients is one of the foremost. He's like the HSA guru.
Oh, really?
He came on and
well, you can tell him that I was in Howardsville, Wisconsin, in the late '90s. Literally a bank that has now been rebranded as HSA Bank. It's actually owned by Webster Bank.
That's right.
All right. Yeah. And I was there in the late '90s, figuring out how to make it work for our clients. And real exciting part. I remember I was 5-6 years into my career, and it was a real cool thing that I became an expert on early that a lot of people didn't know about.
Oh, that's awesome.
And it really didn't take, I was an expert on something nobody cared about for about 10 years. and then 10 years later, there was kind of a cliff vesting type of thing. Like, all of a sudden, people were interested in it. And long story short, what a health savings account does is it allows you, as a member of a health plan, to put money aside into something called a health savings account. It's really just a checking account. But that checking account goes in tax-free, grows tax-free, and comes out for the right reasons tax-free. And here's my promise to you. I will always give you enough bills the rest of your life that it can come out tax-free for no problem. There's always going to be health insurance bills, okay? So whether you decide to retire at 60 or 65 or 70, a health savings account can be used for premiums and deductibles and dental and not orthodontia, but crowns and inlays and vision expenses, hearing aids, CPAP machines. All this stuff is eligible under a health savings account. And while you're working, especially when you're young and you're not using the plan a lot of people, buy the most expensive plan from their employer. Buy a less expensive plan, put money into a health savings account, and I promise you're going to win. I have 5 children. We use the plan all the time. I have a good amount still in my health savings account.
Yeah.
Now, my wife and I have decided that if it's less than $100, we just pay out of our regular checking account.
Yeah.
But the big bills, orthodontia, she kind of, in her mind, it's not hitting her checking account, so it's free. It's a little bit of, spouse math I got to fight off sometimes, But like, in her mind, the kids' orthodontia, it's really not coming out of our household budget.
Yeah.
And I really want to get across that mindset of whether it's formally through a health savings account or through SHP onto a portion that's dedicated towards that freedom of knowing this is what we planned for that. I've found people have sat in my office and they look at each other and it's that, little aha moment. Yeah, we can do this.
We can do this.
We can do this. We've done it and you've earned it. And, nobody's gotten to that point to try and retry at 60 because they haven't worked hard.
The good point you mentioned is like sometimes I have some clients that have had 529 plans and they never use them all.
Right.
And that does happen. My wife and I, we have the HSA. We're just kind of letting it grow because you can invest it. And it's tax, so I'm trying to let it grow to older because, like you said, there's never you're not going to worry about running out of healthcare expenses. There's so much to worry about. So that's if you want a full detailed podcast on HSAs, we have a client that's like Keith said, wrote legislation on it. It's episode 37 of our podcast. So I think we're in the 50s now. That's episode 37 if you want to check back. All right. So now let's say someone is looking towards Medicare. Maybe they do want to work, or maybe they're retired, but they're looking forward to Medicare. No one's ever looked forward to 65 so much as saving money.
Like I said, it's the first time in your life you're going to get good news with respect to health insurance. My retirement plan, I'm going to sell Medicare for the rest of my life. My main talent is selling employers health insurance plans.
Yes.
And I'm going to retire from that because that's a very difficult job at the moment.
Yep.
But meeting with people and showing them their options on Medicare, it's a beautiful, fun event.
Yeah,
so because they're going to
down.
save money. And essentially, when you turn 64, your mailbox and your phone are going to blow up with marketing.
Yeah.
Okay? And there's going to be all sorts of scare tactics and mean and all this kind of stuff. Nothing I can do about that. But essentially just know that when you decide to go on to Medicare, all of your choices really come down to two choices. Do you want a Medicare Advantage plan, which is run by an insurance company? It's what 75% of my clients take. It includes medical, dental, vision, prescriptions, all under one umbrella. But you have an insurance company saying, oh, I know you want knee surgery. Why don't you try physical therapy first?
Yeah.
Okay? So that's just like you have under your employer. There's usually Cigna, Aetna, Blue Cross involved, and they're involved. They're involved on whether or not you're entitled to care. Those can be as cheap as $0 per month. Mm-hmm. So for a couple, they save about $5,000 a year. 25% of our clients take a supplement, which is Medicare is deciding yes or no if you're entitled to knee surgery, and politicians don't say no.
Yeah.
So the experience of being on a supplement is far better medically. You don't get all the bells and whistles. You don't get the dental, the vision, and all that kind of stuff. But if you have tough care issues, a supplement is 99% the better home for you.
Got it.
If you're healthy-ish, you're on cholesterol and heart meds and whatever else, lots of times I recommend save the money, go on to an Advantage plan, because no matter what, every January 1st you can change your mind.
Yeah.
So you can, I'm healthy, let's save the $5,000. We're on a couple of meds and we go to the doctor a couple times a year. Let's save the money, and then next January 1st, we'll enroll. And the worst case scenario is not a bad scenario.
Yeah, it's not like you're going to spend $2 million.
You still have health insurance.
Yeah.
It's basically, you can go on a Medicare Advantage plan and be in the same situation you are under your employer plan. If you Google which one's better, a supplement wins every time, because the people that are experiencing cancer or big treatments or something like that, a supplement is just easier to deal with.
Yeah.
So the tough thing is, the only tough calls I get are in August when somebody got a bad diagnosis.
Yeah.
And they made the other decision in January, and I can't change their plan until January 1st. So the tougher example, and if you look at episode 3, I might have used it way back when as well. But I had this situation, and husband and wife, they both were on an Advantage plan, and the wife had deteriorating, memory care issues, and he found her a bed in August, but they only took supplements, not Advantage plans. And it broke his heart, and I'm like, listen, what we can do is we can just cancel the Advantage plan. And then he was left with Medicare A and B, which meant he had to pay 20% of the bill for the month. Yep. And that's what he did.
Yeah.
That's what he did. So even in that situation, and we're like, listen, in January, we're upgraded to the supplement. Now, sadly, she didn't make it to January. But that's where we got involved. So to me, I've been selling since 1994. That's the one time I've had. And like I said, I don't know when episode 3 was, but it was a couple of years ago, I'm sure. I haven't had another one since either. You know what I mean? But like there's
even that scenario cost-wise, it wasn't like
listen. He had saved $5,000 for 10 years.
Yeah, exactly.
Do you know what I mean?
Yeah,
and he wasn't mad at me. It was just he just loved his wife and wanted to get her where he thought she should be. So, but what I'd like to put out as perspective, if you're on an Advantage plan. And they charge $0 in premium. The reason why they can do that is because the government gives them the budget they've set aside for health insurance. Okay, they say, listen, if somebody signs up for Medicare, we budget this dollar amount per month. And if you're on a supplement, the government's stuck with the bills.
Yep.
If they're on an Advantage plan, then the insurance company's stuck with the bills. Well, the insurance company has found that they say no so much. They manage your care so much, they can give you free dental, free vision, free hearing aids, free prescriptions. So that should put in perspective for you, okay, it's 0, that's great, but there's a reason why.
There's limitations.
There's a reason why. And I think the knee surgery is the perfect, best example, because that's practically what happens in the real world. You want knee surgery. If you're on a supplement, you'll probably get it. If you're on an Advantage plan, they're going to say, we're going to make you go through physical therapy first.
Yeah.
Okay?
Even though
cancer is covered everywhere. Heart attacks covered everywhere. Don't worry about that. It's the annoying stuff that maybe an insurance company can try and save money on.
Yeah. So if people are like listening, right, in their 60s, getting close to 65, when do they actually sign up? Like when? How soon before?
Well, you have to decide if you're going to leave your employer's plan or wherever you're getting health insurance today and go on to a plan. So things come into play. Is my spouse turned 65?
Yep.
And whatever else. So if the subscriber, so the person working that buys the health insurance, if they leave, their spouse has to kind of go with them. Sure. You see what I mean? So we got to factor that in. But the timing is very simple. You can sign up 2 months before, the month of, 2 months after you turn 65. So there's your open enrollment, and then you can always sign up on January 1st. One of the most frustrating things that I hope you guys see and you guys vet out and that I see is somebody is 67, they've been working, they're covered by their employer's plan, and they're paying for Part B.
Yeah.
Because they're afraid of some penalty that's out there. If your employer's plan meets MCC, the minimal creditable coverage from the
most do, right?
If your employer's based in Florida or Texas, check it. But everywhere else, okay, Massachusetts, 100% are credible. If your plan meets minimum credit coverage and you've decided it's the right thing for you to stay on the employer's plan, you should not be on Part B. Yep. And that is just disappointing.
Just money.
Yeah, it's just wasting money. You might be able to get 1 month back, but they're not going to go back a year.
Right.
And it's very tough.
That's a good point, because some people don't. They always ask, if you're working and you have an employer plan, you can wait till after. There's no penalty.
There's absolutely no penalty. And let's say you wanted to quit work, you wanted to retire on May 1st. That's your qualifying event then.
Yeah, it's qualifying.
So we have open enrollment January 1st. We have when you turn 65. But then we have a handful of other dates that include loss of employer coverage. That's a very common one. Yep. But also change of residence. You lost your primary care physician because you moved from the North Shore to the Pine Hills here in Plymouth.
Yep.
Okay, that becomes an event. And in fact, we're going to have a problem with this right now. Stewards closing a handful of hospitals.
I saw that.
And if you were going to Steward and your plan, that was your primary care doctor, that becomes a qualifying event for you because now you can reevaluate and I can make sure you have access to a new doctor that's accepting new patients in that area, which is going to be a problem for us.
So I have a question. If someone's like I get this question a lot. If someone, let's say a husband and wife are on a work plan.
Mm-hmm.
So wife's, let's say the wife's working, she has health care coverage.
Yep.
She's 63.
Yep.
The husband turns 67.
Yep.
Or 65, sorry. Is there any plans to work become cheaper when?
Sure. So like in my office, I pay 65% of my employees' health insurance. So, but I'm only paying 65% of the single or the couple or what have you. So let's say it costs $1,000 a couple, the employee is responsible for $350 there. You see? But if it's $500, they're only responsible for $150. So there's $200 a month.
So sometimes it makes sense for someone to get off,
Correct.
Go on Medicare or the Advantage or whatever.
Which is literally why I do Medicare today. I started doing this because health insurance got so expensive, even when the employer was paying half, it's cheaper for people to leave the plan and go on Medicare and be better off. So if they just pay for Part B, and if they buy the extra $200 for the supplement, fine. But they can leave their employer plan and save money and get better benefits. That's awesome.
Well, you can see, and a lot of clients who have been with us for some 20, 21 years, but in this scenario, for us to be able to give that portion of think of how this, you need a PhD. I always say, people that are do-it-yourselfers, maybe they know how to manage a portfolio.
Right.
But to be able to manage a portfolio, keep up with the changing tax codes, the legislation changes, the healthcare world by itself is like a whole. You need a PhD just for that.
I'm gonna have to re-listen to this episode.
Yeah, that's right. My point is I think that's why we pride ourselves here at SHP of having the best of the best in each category. So clients don't have to worry about going here and there or figuring it out. It's like this is a lot of information, a lot of work for someone trying to figure it out themselves.
I get a lot of referrals from this team here at SHP, and I would say 3/4 of them don't buy insurance from me. They are where they should be. They're doing the right thing. But 15 minutes with me, they feel better.
100%.
They feel better. And
I
now I know what my situation is. Scott, I'll call you 2 years from now.
Yep,
okay,
exactly.
So they're 66 and they think they need to, but they're not retiring to 70. They want to max out Social Security, whatever. They've got all sorts of different plans. And it takes me 15 minutes, 20 minutes, and
something that would take them 3 days to even get close.
And I love you all, but the fact that your sister was in billing in a doctor's office, you don't have to prove that you're smarter than me on Medicare. Okay, I got you. All right, so it's but it's funny. I 15 minutes with me, half hour with me, you'll know your situation, and then we'll go from there.
Exactly.
And it is. I joke, and I'm telling my wife in our part of our financial plan, I'll be doing this forever because they're great meetings.
Yeah,
they're
exactly.
happy people. People are retiring. They're in a good mood.
Yep.
You know what I mean? And there are some negative situations right now. And one of the big ones right now is we have the Ozempics, the Wegovy's, and I think it's Trulicity.
Oh, yeah.
They're tough to get, but they're really expensive.
Yeah.
And
health insurance covers that?
Yeah. So health insurance does, if you're diabetic or, you have to have certain qualifications and that type of stuff. But these are the Enbrel, Humira, the expensive arthritis meds. Those are the tough conversations. So 9 times out of 10, people walk out of my office happy. Yeah. The 1 out of 10 is when one of the family members is stuck with an expensive medication, because that's going to be a financial consideration. We'll have caps and maximums, but
it's still more costly.
It's going to be more costly than you're probably experiencing in an employer environment. And that's one area where I see people decide to stay on the employer plan because a prescription donut hole incidence doesn't apply usually.
Exactly.
And with me, sometimes it does.
Yeah. So, how about if some of the questions if someone's collecting Social Security or not collecting Social Security, does that
doesn't matter? Yep.
Doesn't matter.
So you're entitled to Medicare for the Medicare reasons: turn 65, stopping employer coverage, or those are pretty much the 2 reasons. Yeah. So you can sign up, and if you choose to delay collecting Social Security, believe me, we'll just send you a bill. We're good at billing.
And then after you're on, it comes out of your Social Security.
It comes out of your Social Security.
Well, the other thing too, Keith, we see in planning. So when it comes to tax planning, we try to look at Roth conversions as an opportunity when they're available. Which we always say, it's if you can convert to Roth and it works in your situation. Again, not everyone should go do this. It has to be in a plan. But if you can do it before in your like early 60s, it's a huge advantage because as you get close to or in Medicare age, you start having the Medicare Part B premium conversation.
Yeah, usually there's I always call it 2 taxes we're looking at when we're calculating IRA to Roth IRA conversions. Again, like Derek said, this isn't for everybody,
There it is.
but you really want to make sure that, if it is applicable to you, you're getting ahead, to be able to compound interest tax-free for 10, 15, 20, that's a powerful thing, right? So almost like you were talking about with the HSAs,
right?
Triple tax-free.
Yeah.
When that money comes out, that's a powerful thing.
That's awesome.
So the first tax we look at, is your federal tax, state tax, just your income tax in that regard. Second tax is, and I know Medicare doesn't want to call it that, but it's a tax. It's what you pay in Part B, and the more you make, the more you pay. So when you construct a proposal for a client, you want to take them through, hey, look, here's what you're going to pay in income tax, and if you want to stay in your current Medicare rate, here's the amount we would recommend. Now you kind of make escalations across the board. Hey, if you want to jump to the next one, and you let the client choose, but at least they're educated, they know, and we are taking it into consideration because it is going to cost them money. And it is only a 1-year time frame. They reset that every year, correct?
Well,
Correct.
What happens a lot of times is we have clients that if you do nothing, because you have a good income and you have a lot of money in IRAs.
Yeah, you're getting clobbered down the road.
If we don't do any planning by the time, depending on when the RMD is 73 to 75, depending on their age now, at RMD age, they have to pull money out of their 401ks, IRAs. And at that time, they might have Social Security, investment income, pension. And so maybe right now they're in the lower tier Medicare premium, which right now is $174.70, thanks to Scott. So if you're in the lower tier, that's where you are. But if you start going into the higher tier, it goes from 174 to 257, all the way up to 675 per month per person.
Per person, right?
Depending on where you're, and that's obviously if you have a really high taxable income. But point is, you might be in a good place from 65 to 74, 75. You might, God willing, have 20, 25 years of life left. And if we don't do any planning ahead of time, you might be paying that Medicare premium every single year ongoing, where with proper planning, maybe you can get ahead of that.
You're kind of taking control. And I always say
take the hit 1 year.
Yeah, by not doing it
Or
now,
multiple years.
you're kind of kicking the can down the road into the unknown. The unknown when it comes to Medicare, rules can change.
And taxes
and
go
the
up.
unknown into tax codes. I mean, with the way that we spend money, federally, rubber's got to meet the road somewhere, you know what I mean, in regards to our deficit. It's got to start to get paid down at some point, or some type of control restriction. What's the low-hanging fruit, in my opinion? Retirement accounts. All they have to do is stroke of a pen, they get more of it.
And so think about like the whole point of this is like income planning as you're pulling money out of IRAs relates to tax planning, because how much you take increases your tax bracket, but also relates to healthcare planning. Not just the healthcare in general, but the tax that comes out of it, or the Medicare premium, based on how much income you have for that year. So that it's a puzzle beyond just like...
No, and that's the fascinating part, and why you need experts in all these different areas, because I can barely spell tax. Okay? You know what I mean? It's not my expertise. I am as good as a person you're ever going to find on health insurance.
Yep.
In healthcare, and this gets so complicated, and these rules are changing every year. The dollar amounts are changing every year. There's elections every 4 years. There's all this stuff is happening all the time, and coming up with a plan is just fascinating. And like I said, so there are times where your clients come into my office and they tell me some of the stress. So they ask me, did Keith or Derek or Matt, this is what we're doing. I'm like, no, I'm out of that. I said, I'm not involved in that discussion. I said,
I'm just doing the healthcare.
And usually it's the Roth conversions, and that kind of stuff. And I'm like, guys, I said, I'm here for this one page, okay? But it's fascinating how with planning, people win, and I love this country, but I don't have to give them extra IRMA fees.
Correct.
I feel good about myself,
Exactly. I was at the gym this morning, and one of the guys I see every day, he's been with a firm for like ever, and they're out of a different state. But if he has questions, I help him out. And I was saying, I said, listen, if you have a firm that and I say this all the time, if they just manage your money, and that's all you talk about is like the hey, I have stocks, bonds, mutual funds, annuities, that's like 101 of like retirement. And so I always say, I don't care if it's with us or someone else, make sure you have a firm that has experts in each of those areas. And that's what I mentioned like earlier. If we have an expert in-house team on planning. We work with CPAs and attorneys on the tax side and legacy side. We work with Scott and his team on the healthcare side. So each of these areas, it's like, I always say like, let's say you're putting a brand new lawn in, right? If you just, put it in, it's going to look nice and green right away. But, you talked about all the legislation changes, all the tax changes, all the healthcare changes, stock, everything that changes over time. If you just put a nice lawn in and let it sit there, it's going to go to trash. It's going to be all brown and weeds and everything like that. But if you make sure all the I's and dotted and T's across and you're taking care of all the little weed issues and fungicides and doing the mowing and the irrigation and all these little things like financial planning, the lawn's going to be nice and green. And same with planning. So that's my lawn analogy.
That's awesome.
Not bad, huh? But yeah, so as we wrap up here, I think we've gone through most of the things we want to talk about. I know obviously this is a lot of information and people's heads are spinning, so they might want to listen again. But any final final thoughts or things we didn't cover that is worth knowing?
Just find someone like myself to meet with, when you're 63, 64 years old. Know what you're up against and be ready for that plan. Yeah. And don't be afraid. I'll tell you what the cost of health insurance is, and then you and your financial planners can decide if you can retire at age 60.
Yep.
It's not a no. You don't have to wait till Social Security. You don't have to wait till Medicare. Just know that there's a cost, and it's finite. And the other part, too, is with national health care reform 15, 20 years ago, whatever it was, there is no bad health insurance being sold in the United States. It just isn't. Okay, we've got good health insurance. Your cancers, your heart attacks, all that stuff's going to be covered. All we're talking about is what your copays and deductibles and your access to care issue is. Yeah. And making sure you have access to where you want to go when you need it, to me, is my most important job. The pricing and the dollars are important too, but it's not that big a difference. It's $5,000 per couple per year is my top to bottom delta.
Yeah.
Do you know what I mean? Okay, It's a big number, but it's really not life changing. If your spouse has cancer,
of course.
Right? So really appreciate working with you guys, and we're here for you. We're here for your clients, and.
What's the best? So the easiest way is obviously go to our website, shpfinancial.com, and you can reach out. But what's your website? Brabo?
BraboInsurance.com. BraboInsurance.com. You just Google Brabo, Plymouth, Mass.
Yep.
You'll find it's BRABO, two B's.
Perfect.
But honestly, go through your advisor here at SHP.
Yep.
Believe me, they know how to find me. And half hour. I have a little Calendly link. Set up a half-hour meeting.
Yep.
We can do it in person.
Definitely worth it.
And it's funny. It's funny. My Medicare meetings used to be 100% in person now, and now it's about half.
Yep.
Yeah. People learn Zoom and that kind of stuff.
Us,
yeah. So, but I'm always happy to meet people in person, and we're about 10 minutes up the road from SHP. So.
Right in Plymouth. Yeah. So that's awesome, and as always, thank you so much. You've been a great
really
resource.
Appreciate it,
taking
guys.
care of our clients. And, you can see this is just a lot of information. Don't try to go at this alone. We have help for you to be able to navigate these waters. So thank you so much for joining, Scott. And for everyone, have a great day. And thanks for listening to the Roadmap, SHP Roadmap, brought to you by SHP Financial.
Thanks for listening to the Retirement Roadmap podcast by SHP Financial. If you've enjoyed today's episode, be sure to hit the subscribe button so future episodes are automatically downloaded directly to your device. And if you've liked what you heard, please share the show. Create your own little ripples so we can help even more people with their retirement goals. If you want access to all past interviews, including notes, resources, and exclusive content from SHP Financial, visit shpfinancial.com/podcast. Thanks again for joining us on the Retirement Roadmap podcast. And for all the attorneys out there, disclaimers and disclosures, I'm just going to put on my super serious voice and add our own. No statements made during the Retirement Roadmap podcast shall constitute tax, legal, or accounting advice. You should consult your own legal or tax professional on any such matters. Information presented is for educational purposes only and does not intend to make an offer or solicitation for the sale or purchase of any specific securities, investments, or investment strategies. Investments involve risk, and unless otherwise stated, are not guaranteed. Our investment advisory services are offered through SHP Wealth Management LLC, an SEC registered investment advisor. Insurance sales are offered through SHP Financial LLC. Our advisors and insurance reps may offer clients advice and/or products from each entity. No client is under any obligation to purchase any insurance product.